program. I've done this talk just half an hour before. So the World Aid program is basically from Intel to promote the use of technologies to enrich the lives of people. We are basically looking at the next billion population to be to try and reach out to the next billion population per year. And why we are in healthcare is basically to improve access to healthcare. And we also see that there is a big problem with regard to capacity building and 21st century skills amongst health workforce. We have statistics. I won't be talking about it right now, but we have statistics in terms of the gaps which are there at a worldwide level with regard to the health workforce over here. So it's not just the shortage of qualified health professionals, but it's also various other parameters which are impacting changes in the model of care which we expect. One of them is global aging. Okay. We consider ourselves to be the youngest country. We will be proud of saying that in the next 5 years we'll be one of the youngest countries. But I happen to have a session with Dr. David Bloom, who is from Harvard School of Public Health. And his prediction is that, I mean, it's not a prediction, it's actually a projection, is that by 2050, you would have at least 23% of a population above the age of 65. Okay, and if you talk about that, it would be more than the size of the United States population. And you would have fewer children to take care of them, because while we are doing that, fertility rates are going down. Okay, so fertility rate is now at 2.6. So there will be very few people to take care of the elders. So you're going to see a change in the way in which healthcare will exist in the country. Currently, the government schemes do not talk about aging. They do not talk about elder care, but you will need to start catering to that. We do not have a social security system here. So how do you, now if you see those as one problem, the second side of the problem is NCDs. So you're seeing a lot of chronic diseases which are coming up. How do you actually start looking at your existing deployed sales force, your health force, to address these changing problems? Most of our health force is currently trained on communicable diseases, saying that, okay, here are problems, this malaria program or tuberculosis program or whatever are the various programs which are driven by the ministry. How do you actually now start telling them that, okay, start looking after diabetes, obesity, and various other things, and at the same time maintaining that level of quality of information? Now, in addition to this, this is just skill gap. I mean, this is numerical numbers in terms of what's there. This is from the National Skill Development Council. I won't be touching this. We cannot solve this problem. It has to be solved by, say, the medical institutions, or figuring out novel ways in which you can actually try and increase the total number of students or technicians required to cater to the requirement. But the gaps are pretty significant, and just doubling the number of institutes is not going to help. So you need to think of novel ways of trying to address that. One of the things which we always advocate over here is the shift left paradigm, which basically means that as you move towards the left, your quality of life is going to keep increasing and your cost of care is going to keep decreasing. When you're on the extreme right, you basically are within a hospital in an ICU, where it's the worst scenario. At the left is when you are talking about preventive health. So this is when you actually move in, and as you go along this thing, you're talking about more and more awareness building and education, not just to the health workers, but also to the population. Now, in order to do that, there are various, from a policy standpoint, there are various things, and from a tool standpoint, I'll come to that at a later point in time. But what we felt was there are a few things. Every country says that they want to do an e-health strategy. They would have an e-health strategy. But when you try and execute a strategy like that, do they have anything on basic ICT competence? So currently, if you go and talk to a health worker or to a medical officer or a nurse in a public health or even in a private health system, majority of them do not know how to use ICT. So what can you actually get done by talking about cloud services or anything without actually them knowing basic ICT? So here's an example of the Maharashtra state itself, which is actually doing something called the MSCIT, which is a certification program for any employee which comes into the Maharashtra government. So So this is a very good policy initiative from the state. So any employee, whether it's transferred right from the chief secretary down to the A&M on the ground, has to complete this to get enrolled. This could be just copied by other states, if that's the easiest thing to do. The second part of it is you need to have advocates within the system. Currently, where we lack as a country is that we do not have anyone who is advocating use of ICT and who understands how ICT needs to be used within the government. So, an example of this is from Sri Lanka. I just want to give this thing because we are doing projects over there, and what we found is they are far more adept at using this. So, Sri Lanka has teamed up with the University of Colombo and created a course called the Postgraduate Institute of Medicine. This is a 2-year medical informatics course. But creating the course is not a problem. We ourselves have such courses in India as well. The government over there has nominated one doctor each, a young doctor, from each of its institutes, not just the hospitals, but also from the things like our equivalent of NIHFW. So people who are from the public health side, as well as from the curative side, we've nominated them to go for this 2-year course. So they are medical doctors undergoing an informatics course. Post that course, they get redeployed back to their individual hospitals and they become the CIOs, erstwhile CIOs of those hospitals. So what you have is an e-health strategy, and you have advocates within those people who will address the change management issues. So that's a beautiful model in terms of saying that, okay, how do you ensure that you could deploy something? Prioritize the projects which need to be implemented is, again, one more thing, but I won't get into that. Reducing the burden of in-service resources. Okay, most of our time, rather than going into actually spending time with the patient, goes into reporting in the public health system activity over here, because they're doing non-value-added activities. So we are working on projects around that and augment the existing training mechanisms. If I have 1 million health workers spread across the country talking different languages, how do you expect quality of training to remain constant across all of them? And at the same time, if you're planning to do a face-to-face training mechanism, how do you ensure that that training is done in a rapid period of time? Because it will take you close to around 6 months to just do a SARS training or something like that. This is a commitment which Intel made at the United Nations. It's basically to say that we will enable 1 million health workers in developing countries with technology education tools and 21st century skills by 2015. This we do along with the ecosystem, that is development agencies, governments, NGOs. One of the first countries is Sri Lanka, where they have made a commitment. If you go to this website, which is a UN website, you'll see that commitment over there, both from Intel and from Sri Lanka, on training the entire workforce using technology tools. And the talk which I mentioned about basic ICT competencies, that's also mentioned over there. So while working with them, we said that what's the tool which we were talking about for training of their health force? We had to create something called School Healthcare Education Platform. Now I'll just give you a quick look at that. This is an online-offline tool which we had to create over here. Now if you look at this interface, it's extremely simple. Okay, it's been made in such a way that there won't be more than 2 or 3 actions which need to be done, because this is to be used by 10th grade plus health workers in the field. Now we've actually looked at it in terms of role-based. So if you want more details on this thing, you can actually go there. But I just wanted to show you some things like this kind of a course. The volume is not working, but this is the content which is from Hesperian. So if you're talking about danger signs in pregnancy, they have a book called Where There's No Doctor, okay, which is visually representing how A&M can actually, or a person where there's no doctor can actually understand a problem, a symptom. So we are working with them to try and see how we can digitize their content, repurpose it, and it won't be just in English. So there is English over here, there's a voiceover in English, currently it's not working here, and we also have it in local language. So it will be in Tamil and Sinhalese currently, but we can work with whoever other people to do that. Now, just to show you this, it can also have HTML, it could have PDF or any other mechanisms. But the intent over here is not just that, but for example, here is a content on breastfeeding. So this is again content which is created by the Sri Lankan government. Now, what we are trying to do is get into agreement so that the same content could be used by other governments, so that it becomes a common pool. And we also work with the UNFPA and various other agencies on that. After the content is there, you need to really have a quiz. The quiz is not to certify them, but to just do an assessment to understand whether they've understood it or not. We have dashboards at the back end to actually showcase whether the courses are completed or not. So if you go to a PhD doctor, you can see that the 6 ANMs who reporting to him, have they completed it? So you can go upwards all the way up to the state to have those dashboards. Similarly, you have it by content. It's not necessarily that you need to have, if everyone's failing a particular course, there could be a problem with the content. So we have dashboards either which way. Am I on time? That's about it. So that's basically a snapshot of what we are doing with regard to capacity building. At the last mile, we have other programs which are on nursing education, health education for doctors, and for even ICT education for normal, with the IMA. We work with the IMA and see how we can actually drive that. So just a snapshot of.
Thank you, Ashok. It is